One of the most important members of the treatment team is the patient and their family. I always like my patients to be very well informed about their disease and very involved in the treatment plan. I want to make sure when you leave a visit with me that you understand exactly what the next step is, when the next visit will be, what if any treatment is ongoing. If that's not clear before you leave your doctor's office, I would encourage you to pause and to ask them to explain again exactly what the next few steps will be. More and more physicians are providing doctors with written summaries, either through a patient portal, paper form, or by email, that summarizes the key findings of the visit. And I find that very helpful as a physician in making sure that the key messages are out to my patients. And I know the patients find it very helpful in making sure that they didn't miss anything during the visit. Other key questions you may want to ask may relate to whether you're starting a new treatment, and if you are, what potential side effects are from that, whether there are other treatment options that you might consider at this point. Many patients like to know whether the treating physician has other patients who've gone through the same thing, and if so, what side effects they've had, what positive benefits they've seen, and at times whether you could talk to them and ask them directly about what their experience has been. Often another patient can be a terrific resource because they're actually going through the chemotherapy or going through the radiation. The doctors order these things and prescribe them or perform them, but we're not the patients and we don't have that same experience. Most important to me at the end of every visit is that it's clear in the patient and the patient's family mind exactly what the treatment plan is, what the next steps are, and what things the patient is responsible for doing. I have a few patients where I fear if they didn't get their appointment slip in the mail, I would never see them again. Those are the hardest patients for me. I prefer my patients where if the mailman drops the slip, they would call me up the next day and say, "Hey, I was supposed to have an appointment in 2 months and I haven't heard from you. What's happening?" Well-informed patient is a key part of our treatment team. Being diagnosed with a brain tumor is a very scary ordeal for patients and their family. Usually this sort of news comes out of nowhere, and at first patients feel very unprepared to deal with making complex medical decisions and other life decisions based on this new news. I would encourage you, to the extent that you can, to get your family and friends involved, to bring them with you to visits. They can serve not only as a source of support, but can also listen, ask good questions, and later help you recall exactly what was discussed in your visit. I'd also encourage you to try to find other patients who've gone through things that you're currently going through or will face in the future. Organizations like the Guideposts of Strength can provide patient mentors and also mentors for your family who can provide significant insight and reassurance to you as you start down this journey. Brain cancer is a difficult disease to treat, but there are many, many promising therapies, and I personally have many patients who have fought the battle with brain cancer and gone on to live wonderful, full lives. Good luck to you, and thank you for your time.